Young children who are suffering from, both the kidney failures. I've interacted with such patients, and there are young people who require, till 2-year-old people who require. What was said is end of life. End of life, nobody's giving them a quality of life. Quality of life is something that you want to actually see that, they don't feel that, they are reaching the last stage of their life and they're totally in a neglected state. But instead, we need to give them hope. We need to build hope and also see that there is sufficient medical care that is given to them. Today on this occasion, I want to also announce to the Dean and the Director of Health Services that we will move a proposal separately. That just like how we take care of the patients in the health services, how we take care of the patients in the Goa Medical College inpatients. During my tenure that we started free medicines, and Goa is the only state that we give free medication to people, inpatients and even outpatient in terms of all the healthcare and other type of facilities and other issues that they have, like diabetes onwards to various other things. And life-saving injections and each and every facility is made free of charge. I want to actually tweak this policy. I want to tweak this policy in a manner in which to identify and bring the NGOs under the same gambit of what we want to do, and also to create a kind of a work profile and work opportunities for even nurses, matrons and all who have actually retired, doctors who have actually retired. Try to create a sort of a structure, and that structure should be integrated into the healthcare policy in the state so that they can actually be indirectly a part of the government and on a particular salary. That's why I said that we need to have 3 centers. We need to have a palliative care center in South Goa, which is funded by the government, not only in a ward-based system, but where even we have various categories of people, and they are totally funded by the government. And where our staff who has retired, who would like to work, who has the energy to work, can become a part of that system and take that forward. In addition, we want to have a system. With this, what I am saying is with total commitment to this policy, is that we want to have a palliative care center total, dedicated and backed by the government of Goa, a palliative care center in North Goa and one in the Ponda district, so that we are able to cover these 3 areas. It is important for us to understand when you students are here. I was looking at facial reaction of some of the students because I am very inquisitive knowing how your thought process is and which direction we are going. It is important, some people connected with the video, some people connected with actually what is happening. Primary care, secondary care, tertiary care of palliative care is also something which is very important for us to actually understand and take forward. It is important that the Goa Medical College, along with the doctors and also the new medical officers, because we don't have born doctors anymore now according to the new rules, but at least these visits, I was looking at the form that was shown in the policy. Those forms, exactly what is the type of the frequency that is required for the doctor or somebody to go home. So we need to integrate. We need to integrate the system in such a fashion so that these doctors visit along with, suppose Dr. Ira is heading this particular foundation and she's here in Goa taking care of all this, but then she has to be backed up by the department. Doctors have to go and make these home visits. For that, to create an independent structure that will actually help people and give them a better quality of life. They'll feel that they're cared for. They'll feel that they are, they are looked after by the state. And it is important for the state to start looking after its citizens. It's not really enough to come and launch a palliative care policy and then forget about it after we go out of this room. It is very important. So I suggest that we immediately move and tweak this policy and to see that we integrate these centers. It is important. It is the vision of the Prime Minister that every person receives health.